Hello everyone, my name is Brianna Espiritu and today I'll be talking about asthma. It's a chronic inflammatory disease of airways. Asthma is characterized by episodes of wheezing, breathlessness, chest tightness, and coughing, especially in the early morning or at night. These symptoms are linked to airflow obstruction that is often reversible with treatment. Asthma is caused by a complex mix of genetics, environmental, and immunological factors, all leading to airway hyperresponsiveness and inflammation. Let's look at the causes of asthma. First, genetic factors play a big role. If someone has a family history of asthma or allergies, they are more likely to develop the condition. Environmental triggers such as air pollution, pollen, mold, pet dander, and dust mites can worsen or even trigger the symptoms of asthma. Occupational exposure is another important cause. Workers exposed to dust, fumes, or even chemicals such as cleaners and construction workers are at higher risk. Lastly, viral infection during childhood can increase the chances of developing asthma later in life by affecting the lung development. We'll look at the significance asthma has in public health. It affects people of all ages and is significantly increasing healthcare use, such as ER visits and hospitalization. The asthma impact goes beyond health. It affects productivity, school attendance, and quality of life. Public health efforts focus on prevention, education, and improving access to care to reduce asthma-related deaths and complications. We're going to go over the prevalence and burdens of asthma. First, direct medical expenses account for the largest portions at 40%. Next, school days represent 25% of the total costs. Illness doesn't just impact health, it disrupts productivity and education too. Premature deaths make up 15%, emergency visits make up 12%, and hospitalization makes up for 8%. Let's dive into how asthma has changed over the years. We're going to look at the trends. Asthma rates have been steadily rising from around 7% in the 2000s to 9% in 2023. Asthma is more common in urban areas due to pollution and house conditions. In 2023, urban asthma prevalence was 10.3% compared to 7.2% in rural areas. Asthma rates are higher among African Americans and Hispanic population, and among people living below poverty line, where rates exceed 11.5%. These trends highlight how environmental, social conditions, and income levels all contribute to asthma risk. Now let's look at the health disparity in asthma. Race and ethnicity play a role. African Americans and Latinos have higher rates of asthma. They are twice as likely to have asthma and 5 times more likely to die from it, according to the CDC. So socioeconomic factors like low-income families often have less access to healthcare and medications. Poor housing with mold or pests can also worsen the symptoms of asthma. Environmental justice is another factor. Minority and low-income communities often live in areas with poor air quality, increasing the risk of asthma. Clearly, asthma is about more than just individual health. It's tied to social and environmental inequalities. How can we prevent asthma or reduce its impact? We can reduce it by reducing the exposure to triggers like tobacco smoke, allergens, and air pollution. Second, early child interventions. Teaching families how to manage asthma at an early age can make a big difference. Third, public health campaigns like clean air initiatives help raise awareness and push for healthier environments. Efforts like these can lower asthma rates and improve quality of life for millions. Now let's look at the public health interventions. Asthma management programs help individuals control symptoms and avoid severe attacks. School and community education teaches kids, parents, and communities how to handle asthma. Policy interventions, smoke-free laws, and clear air regulation reduces exposure to asthma triggers. Each of these strategies help build healthier communities, especially those who are most vulnerable to asthma. Now let's look at the healthcare access. Healthcare access is crucial for asthma, but there are barriers. High costs and lack of insurance make it hard for someone to get proper treatment. Primary care providers help diagnose and routine management, while specialists can treat severe asthma cases. Educational is critical for both for the patients learning self-management techniques, for providers staying current on best practices. Without good access and education, asthma becomes much harder to control. Now let's look at asthma's future. Research is uncovering new genetic environmental links to asthma. Innovation treatments like biologic therapies offer better control for those with severe asthma. However, ongoing challenges remain, particularly addressing disparities in asthma care and outcomes. By continuing to innovate and focusing on equity, we can move forward in the future where asthma is far less of a burden. Now let's look at the key points. Asthma is a serious and common disease affected by genetics, environments, and healthcare access. It causes major health and economic problems, especially in low-income and minority groups. Why public health matters. Prevention, education, clear efforts, and better healthcare access are key to fighting asthma. We can support prevention and improve healthcare access and invest in research to reduce the impact asthma has to the communities. And here are my references, and thank you for listening to my presentation.